Hi everyone, I'm Jillian Andrews. Dry Eye Treatment Center of Connecticut at Higgins Brothers Vision Care provides a variety of therapies and treatment options to ease symptoms. Here to tell us more is Dr. Donald Higgins. Thanks so much for joining us.
Thank you for having me.
So first, let's just start off with an overview of your practice and what you offer.
Yeah, so we are a specialty dry eye center. This is what we do, and we have the latest in diagnostic equipment. I think one of the biggest pieces of equipment I have is my brain that completely understands, okay, what's causing this, and then how to come up with a specific treatment plan that's going to be custom tailored for this particular patient's need. Coupled with that, we have every piece of technology from intense pulse light therapy, radio frequency. We do meibomian gland probing, platelet-rich plasma. We just added OptiLift, which is a brand new instrument. There's one or two in the state that have this. It's going to do dynamic muscle stimulation. We think part of dry eye disease may be a poor blink, and so this will help stimulate the orbicularis muscle, and then you get a cosmetic lift out of it. So I know I'm going to be using it on myself to get rid of some of these bags. Yeah, and then we support the patient through the whole process.
Yeah, you have a customized treatment plan really for all your patients.
There is no one treatment plan, and you know, I've had patients say that to me. I've been to other centers, but they seem to have one treatment plan for all, and we start with that diagnostics. I want to know what's going on systemically, what medications you may be taking, and then based on what we find at that initial workup, we will come up with a customized treatment plan that's just best for you.
Yeah, and certain symptoms might be more bothersome for certain patients, and so they might need a different, a different way of solving things.
Yeah, 87% will have meibomian gland dysfunction, and that's where intense pulse light therapy will come in. But there are patients who just don't produce enough tears. They tend to be patients who have autoimmune conditions, Sjogren's syndrome, rheumatoid arthritis, systemic lupus, things like that. And in those cases, we work on increasing the supply side of tears. And then the ones who come in with aqueous, not aqueous deficiency, but evaporative disease, then we'll work on the meibomian gland side of it. And what's interesting, most of our patients don't need drops by the time we're done with them.
Wow. And where can people go to learn more, book an appointment with you?
Sure. Yeah, we have a website. It's drdhiggins.com. Our office number is 860-793-9613. We're always happy to see new patients.
All right, drdhiggins.com. Thanks so much for your time.
Thank you for having me.
All right, for CT Buzz, I'm Jillian Andrews.